Go.
Hi, today I'd like to talk to you about preventative health care. Public health is the art and science of protecting and improving the health of communities through education, promotion of healthy lifestyles, and research for disease and injury prevention. This is a quote from the organization, What is Public Health? It is a part of what I'm here to encourage you to do today. Encouraging you, your family, and your friends to take advantage of preventative screenings is what I portray is the next step to decreasing those cancer statistics. I have worked in the healthcare field for 4 years, and during this time I have met many people who have encouraged me to take care of my health by getting preventative screenings. I've also met people who defeated an upcoming death by taking care of this matter. Today, my purpose is to encourage you to follow health screening recommendations specific to your gender and age, so that you can be aware of potential diseases before they become serious. We will learn about the new options available, jaw-dropping statistics, and why it is inevitable to keep up with this. Preventative health care helps us maintain a healthier life while monitoring possible diseases before they become worse. We will begin by discussing a few of the common health screens that are available to you. According to breastcancer.org, finding breast cancer early reduces your risk of dying from the disease by 25 to 30% or more. Mammograms are a powerful exam that assists in finding cancer at its earliest stages. And although for women breast exams are very important to know and perform, we cannot solely rely on them because by the time we are able to fill a lump, the stage of the cancer has most likely advanced to a much later stage. Kelsey Buntain, a NICU nurse in Louisville, Kentucky, is a prime example of this. She started receiving her prevention mammogram early at the age of 26 due to a strong family history. It was discovered at her young age that she had been the victim of breast cancer at only 26 years old, and she required a bilateral mastectomy. The World Research Foundation says that you should visit your doctor annually or more often as you get older in order to stay healthy and catch any disease early. For example, after the age of 50, a colonoscopy is recommended every 10 years, and a fecal occult blood test is recommended yearly. However, if you have a strong family history, it is recommended at a younger age or more frequently. Even routine physical exams are an important preventative health screen, and it's suggested that you have your blood drawn every year to check for things such as your thyroid level, cholesterol, triglycerides, and general blood counts. Now I would like to tell you why I believe you should participate in preventative health screenings. According to the Center for Disease Control and Prevention, chronic diseases such as heart disease, cancer, and diabetes are responsible for 7 out of 10 deaths among Americans each year and account for 75% of the nation's health spending. These chronic diseases can be largely preventable through close relationships with your healthcare team, or can be detected through appropriate screenings when treatment works best. Preventative health screenings have many benefits that we as humans choose to ignore. By getting regular health screenings, people have discovered diseases such as cervical, colon, and breast cancer at an early enough stage where treatment was minimal. President Barack Obama recently enforced the new Affordable Care Act, providing new benefits related to preventative screenings. Insurance providers are covering some preventative screenings such as an annual pap smear. However, you're probably thinking that you don't have the time or the money to participate in these healthcare screenings. So how can you take the next step comfortably? Here is a short video that briefly just gives an example of this new law.
Oh, Mark! This is my grandson. And if it wasn't for screening I got, I might have missed being here to meet him. The healthcare law lets those of us on Medicare now get most preventive care for free, like annual wellness visits, immunizations, and some cancer screenings. And that's when they caught something serious on mine. But we could treat it before it was too late. I'll be around to meet number 2. Get the screenings you need. Learn more at healthcare.gov. Oh, you don't want to miss miss any of this.
According to the U.S. Department of Health and Human Services, insurance providers are required to cover preventative screenings at no cost to you. You can live a healthier life while saving your wallet the heartache too. You can visit the Center for Disease Control and Prevention for a list of screenings that are recommended to you based on your age and gender. Please speak with your physician regarding their recommendations suggested to you based on your current and past family and personal medical history. Annual screening mammograms started at the age of 40 save lives, says Dr. Pletcha, and breast cancers are most likely caught in the initial stages by mammography and are more likely to be cured and less likely to require chemotherapy or an extensive surgery. Kelsey Bunting is a prime example that harmful cancers can happen to anyone at any age. And about 50,000 Americans die every year from colon cancer that could have been prevented with a yearly colonoscopy. We can solve this problem and decrease statistics by being proactive and signing up for regular health screens every year. But most importantly, I want you to take advantage of these offerings and live a healthier life so that you can enjoy to live your life to the fullest every day. In conclusion, I'm asking that you take what we have learned today into consideration. We have learned about the new options available due to the Affordable Care Act, some common screenings, statistics, and stories of real-life people and situations. We've also learned why it is important to monitor our health status regularly. I want to thank you for your participation on helping America live a better and